Welcome all. Myself, 1K MD, Assistant Professor, Department of Pharmacology, Channabasweshwar Pharmacy College, Latur. So today we will discuss about treatment of tuberculosis, also known as pharmacotherapy of tuberculosis. Means how tuberculosis which is treated by using different antitubercular drugs. The conventional 12 to 18-month treatment has been replaced by more effective and less toxic 6-month treatment, which also yield higher completion rates. Means in replace of that 12 to 18-month treatment, we can use the 6-month treatment, because that's 6-month treatment which is more effective or more efficacious as well as less toxic. For that purpose, we are preferring that 6-month treatment for management for pharmacotherapy of TB, for treatment of TB. The goal of antitubercular chemotherapy are, so there are mainly 3 goals during the chemotherapy of antitubercular drugs. So first is that kill dividing bacilli, second kill persisting bacilli, and third prevent emergence of resistance. So we'll discuss one by one. So first of all, kill dividing bacilli. In that, the drugs with early bactericidal action and rapidly reduce bacillary load in the patient and achieve quick sputum negativity, so that the patient is non-contagious to the community. That means transmission of TB from one person to another person, which is interrupted. So that is the first goal, kill dividing bacilli. Then second goal is that kill persisting bacilli. In that, to effect cure and prevent the relapse, and this depends on sterilizing capacity of drug. Means through the treatment, we have to cure the TB infection as well as we have to prevent the relapse of TB. This is the second goal. And third goal, that is prevent emergence of resistance, means to avoid the resistance of bacilli against the anti-TB drugs, so that the bacilli remains susceptible to the drugs. Okay, so these are the 3 goals of antitubercular chemotherapy drugs. Next, we'll discuss about short course chemotherapy. In short, it is known as SCC. These are regimens of 6 to 9 month duration, which have found highly efficacious. Means that short course chemotherapy, which is found to be highly efficacious. After several years of experience, a WHO expert has framed a clear-cut treatment guidelines in 1997 for different categories of tuberculosis patient. The dose of first-line anti-TB drugs has been standardized on body weight basis, as well as it is applicable to both adults as well as children. So first-line drugs, which is standardized, which is based on their body weights. So look at this chart that's showing the standardization of that first line drugs, which is based on body weight. So this is the drugs like isoniazid, then second rifampicin, pyrazinamide, ethambutol, streptomycin. So that drugs which is given daily, or it is also given thrice weekly, means 3 times per week. The doses which is reduced to 750 mg above 50 years of age and to 500 mg above 65 years of age, as well as a patient with renal impairment. So look at the dose of isoniazid. So the daily dose, which is 5 mg per kg. So for person body weight more than 50 kg, it is 300 mg. Then rifampicin daily dose, it becomes 10 mg per kg. For person body weight more than 50 kg, it is 60 mg. Pyrazinamide 25 mg per kg. For person body weight more than 50 kg, 1500 mg. Ethambutol 50 mg per kg and 1000 mg for body weight more than 50 kg. Streptomycin 15 mg per kg and again same 1000 mg for body weight more than 50 kg. And again, so that chart also showing the drug doses thrice weekly. Okay, we can give that treatment thrice weekly or daily basis. So this showing the doses for daily basis and this column showing the doses thrice weekly. So isoniazid 10 mg per kg thrice weekly. Then rifampicin 10 mg per kg thrice weekly. Pyrazinamide 35 mg per kg thrice weekly. Ethambutol 30 mg per kg thrice weekly and streptomycin 15 mg per kg thrice weekly. And that column showing the doses whose body weight which is more than 50 kg. Okay, so this is the chart which is showing dose of first line anti-TB drugs on the basis of body weight. So in that short course chemotherapy, so it consists of two phases, that is initial intensive phase and continuous phase. So all regimens have an initial intensive phase which is lasting for 2 to 3 months. And the aim of that initial intensive phase is to rapidly kill the tuberculosis bacilli. And this initial intensive phase, which is followed by a continuation phase, which is lasting for 4 to 6 months, during which the remaining bacilli which are eliminated so that relapse does not occur. Then that treatment of tuberculosis, which is categorized by, so it is categorized by, first is that site of disease, either it may pulmonary or extrapulmonary, as well as its severity. Then second is that sputum smear positivity or negativity. And third, history of previous treatment. So we will discuss one by one treatment of TB as per the category. So category-wise treatment regimens in that first category. So that first category, which includes following types of patients, in that new untreated smear positive pulmonary TB patient. Then second is that new smear negative pulmonary TB patient with extensive parenchymal damage, that is extensive scarring formation in the lungs. And third is that new severe forms of extrapulmonary TB patients, that is meningitis, pericarditis, perionitis, then bilateral extensive pulmonary effusion, spinal TB, intestinal TB, or genitourinary TB. So that kind of patients, which is categorized in category 1. Then treatment. So look at the treatment for category 1 patients. So it is divided into 2 phases, initial intensive phase and second continuous phase. So during initial intensive phase, that category 1 patient which is treated with 4 drugs, that is isoniazid, rifampicin, pyrazinamide, and ethambutol or streptomycin. That 4 drugs which is given daily or thrice weekly for 2 months. Means that 4 drug treatments for category 1 patients which is given for 2 months daily or thrice weekly. The revised National Tuberculosis Control Program, that is RNTCP, which has been launched in India in 1997 and which is implementing DOTS, that is directly observed therapy. Means during that DOTS, some of the trainers which is giving the treatment for TB and watching the status of their treatment. The RNTCP recommends that if patient is still positive, sputum positive at 2 months, then intensive phase should be extended by another month and then continuation phase is started regardless the sputum status at 3rd month. Means during the treatment after 2 months, the sputum of that patient which is evaluated, and if sputum test is positive, then again that 4 drug treatment which is extended for 1 month, and then sputum test which is performed, and through the result of that sputum test the next continuation phase will be provided. So continuation phase. So in the continuation phase, here 2 drugs, that is isoniazid and rifampicin, which is given for 4 months, or isoniazid and ethambutol, which is given for 6 months. When both isoniazid and rifampicin are used, that used thrice weekly regimen is permissible. Under RNTCP, that is revised National Tuberculosis Control Program, thrice weekly treatment with isoniazid and rifampicin is given for 4 months, and this phase will be extended to 6 to 7 months. That means total duration of that therapy is 8 to 9 months for tuberculosis of meningitis as well as tuberculosis of spinal disease. In the areas where DOTS has not been implemented, use of thiacetazone in replace of ethambutol in the continuation phase is permitted, except in HIV positive cases. So this is the treatment or pharmacotherapy for category 1 patient. Now we will discuss about category 2 patients. Category number 2 patients. So here the patients with smear positive failure, relapse and interrupted treatment cases, that comes under category 2. So we'll discuss about that. That is, first is that treatment failure. So treatment failure in that patients who remains or again become smear positive for 5 months or later after commencing the treatment. Also one who has smear negative at the start of the therapy and becomes smear positive after the treatment of 2 months. That patient which comes under category 2. Then relapse, a patient declared cure from any kind of TB in past, but after receiving the 1 full course of chemotherapy, but now the patient becomes sputum positive, means relapse or reoccurrence of TB occurs. That means relapse, and such patient also comes under category 2. And third, treatment after interruption, that is a patient who interrupts treatment for 2 months or more and return with sputum positive or clinically active tuberculosis. So such patients comes under category 2. Here we will discuss the pharmacotherapy for category 2 patients. So patients may have resistance bacilli and are greater risk of developing MDR TB, that is multi-drug resistance TB. So during the treatment in the category 2 patients, so there is a greater risk of multi-drug resistance TB, means resistance occurrence for antitubercular drugs. So look at the pharmacotherapy. Initial phase. So here all 5 first-line drugs are given for first 2 months and later followed by 4 drugs, that is isoniazid, rifampicin, pyrazinamide, ethambutol, for another month. And continuation phase is started if sputum is negative, but 4 drug treatment is continued for another month if sputum is positive at 3 months. The next is that continuation phase. So 3 drugs like isoniazid, rifampicin, ethambutol, which are given for 5 months, either daily or thrice weekly, as per RNTCP, that given thrice weekly treatment. So this is about category 2 patient pharmacotherapy. Now we'll discuss the category 3 patients. So these are new cases of smear negative pulmonary tuberculosis with limited parenchymal disease or less severe forms of extrapulmonary TB, that is lymph node TB, unilateral pleural effusion, or bone TB, peripheral joint or skin TB. So such patients comes under category 3. So look at the treatment for category 3 patients. So in the initial phase, 3 drugs, that is isoniazid, rifampicin, ethambutol, given for first 2 months, and that are enough because of bacillary load is smaller in case of category 3 patient. And in the continuation phase, this is a similar to category 1, that is for next 4 months we are treating isoniazid and rifampicin daily or thrice weekly, or isoniazid, ethambutol daily or thrice weekly for 6 months. In replace of that ethambutol, we can use thiazidazone. Under RNTCP, only thrice weekly isoniazid rifampicin regimen is followed. Next is that category 4. So category 4 patient. So these are chronic cases who has retained or have become smear positive after completing fully supervised treatment, that is category 2 regimen. And these are most likely MDR cases, that is multi-drug resistance TB cases. So in that we'll discuss about what is mean by MDR TB. So MDR, that is multi-drug resistance TB, which is defined as the resistance of both isoniazid and rifampicin and maybe any number of other anti-TB drugs, and that MDR TB which has a more rapid course. In some, the patient may die in 4 to 16 weeks due to MDR tuberculosis. So during the MDR tuberculosis treatment, that cases are difficult because of 1 or more second line drugs are to be given 12 to 24 months, and that second line drugs are less efficacious, less convenient, more toxic, and more expensive. So therapy of that MDR TB cases depends upon the drugs used in earlier regimen, as well as presence of associated disease like diabetes, leukemia, AIDS, etc. So here, look at the treatment for category 4 patient. If sensitivity of tuberculosis bacilli is known, then drugs to which they are resistance are excluded. Means if we know what kind of drugs which is resistance in that patient, then we can exclude such drugs, and we use other first line drugs prescribed alone with 1 to 3 second line drugs, and the total we are using 5 to 6 drugs given for the treatment of category 4 patients. So look at the treatment for isoniazid resistance patient. We have to use rifampicin, pyrazinamide, ethambutol, which is given for 12 months. Then second is that for isoniazid and rifampicin resistance patient, we can use pyrazinamide, ethambutol plus streptomycin or kanamycin or amikacin or capromycin. So out of that 4 drugs, we have to use 1 drug plus ciprofloxacin or ofloxacin. Out of that ciprofloxacin or ofloxacin, use 1 drug plus or minus ethonamide. So ethonamide, as per the need, it can be used, and the actual regimen is devised according to the features of the individual patient. So category 4 patient, again one consists of, that is extensively drug resistance TB. So category 4 patients which develops that XDR TB. So TB, recently the WHO and CDC USA have identified TB cases that are extensively drug resistance, and this term has been applied to bacilli that are resistant to at least 4 most effective cidal drugs. That is the cases resistance to isoniazid, rifampicin, fluoroquinolones, and one of the kanamycin, ampicin or capromycin, with or without any other number of drugs. The global survey for period of 2002 to 2004, which has been found that 20% of TB patients which having MDR patient, that is multi-drug resistance patient, and out of that 22% which are XDR, that is 2% patient which is extensively drug resistance TB patient. The extensively drug resistance TB is virtually untreated, and the mortality rate which is high in extensively drug resistance TB patient, and particularly that mortality among HIV positive patient. Okay, so this is about category 4 which develops extensively drug resistance, that is XDR TB. Now last, we will discuss about category wise alternative treatment regimens for tuberculosis as per WHO in 1997. So here that's showing the category 1, category 2, category 3 and category 4 of tuberculosis. This showing second column, that is initial phase, the dose which is daily or thrice weekly. Then next column showing continuous phase, and that fourth column showing the duration of therapy. So number before the treatment, that number before a phase, which is the duration of month, that 2 indicates 2-month therapy, and 4 indicates 4-month continuation therapy, and 2-month initial phase and 4-month continuation phase. And that subscript, so look at this subscript H3 R3 3. So that subscript number which showing the doses per week. So that means H3 means that is isoniazid thrice weekly. Okay, so that subscript number 3 which indicates a dose of drug per week, and if there is no any subscript to the number, then the dose is given daily. Means here, look at that HRZ. So H means that isoniazid which is given daily. Okay, the dose is given daily. So this is the treatment chart. So category 1 patient. So in the initial phase, we have to give 4 drugs. That is isoniazid, rifampicin, pyrazinamide, ethambutol, or streptomycin for 2 months. And in the continuation phase, isoniazid, rifampicin for 4 months, or isoniazid, ethambutol for 6 months. So that is the total duration is 6 to 8 month therapy. Then category 2, so that is the drug, and treatment is lasting for 8 months. Category 3, so that drug treatment, so that treatment lasting 6 to 8 months. And category 4, which is chronic phase, or that is XDR tuberculosis phase. So here, next table that showing treatment regimen, which is followed in India under revised National Tuberculosis Control Program, that is RNTCP, through 1997. So it's showing the category of tuberculosis, the category 1, category 2, category 3. This is the initial phase. So for category 1, that RNTCP, which giving the doses thrice weekly. So you will see that each drug which showing the subscript 3, that means that dosage given thrice weekly. So initial phase, isoniazid, rifampicin, pyrazinamide, ethambutol, that all drugs given thrice weekly for 2 months. That 2 indicates 2 months. And in the continuation phase, isoniazid and rifampicin, which is given thrice weekly up to 4 months, and total duration is total 6 months. So category 2, total duration 8 months, and category 3, total duration is 6 months. So this is about pharmacotherapy of tuberculosis. So these are the references for antitubercular drugs as well as treatment of tuberculosis or pharmacotherapy of tuberculosis. Thank you. Thank you very much.